following appropriate next step in management? Laparoscopic lysis, hysteroscopic methotrexate, in vitro ions therapy. So 28-year-old woman has secondary amenorrhea with past 6 months. First gynecologist. She had a dilation and cutting procedure after a miscarriage 8 months ago. She denies any pelvic or PID, STIs. A remarkable hysterossalpingography shows adhesions with the uterine cavity. Which of the following is the next appropriate treatment? So secondary dilation. So my two main things that I'm kind of trying to think of is one, it says she has adhesions within the uterine cavity, and I know she had dilation and cutters, so like that could be an issue. But then it says secondary amenorrhea, which makes me think upstream to like an anterior pituitary issue. So like I'm stuck between looking at the uterus and upstream. I mean, but I don't know what methotrexate would do. So I'd probably get rid of that. And what is she wanting to do? She has, oh, so she's not, I mean, amenorrhea, which means she's not having any periods. Yeah, that's what that means. And I don't know, I mean, doesn't say she's wanting to have kids. So I don't know if she's worried about the pain or what she wants. Like, I mean, because I don't know what in vitro would do unless she wanted kids, but it doesn't say in the question stem. Because it's more of like an anatomic thing with adhesion. Do you? I guess stick with adhesion hysteroscopic. I don't.
Yeah, what do you so you got to be thinking, okay, what is the most likely cause of her amenorrhea?
Um, her dilation and cut, like the adhesion, like maybe she can't
Probably.
grow the.
Yeah, that's
And
probably kind of what I'm thinking, right? Most likely cause of her amenorrhea is probably caused by scar tissue, right? Inside the uterus with adhesions. And obviously, right, if you have adhesions that are causing amenorrhea, then that's going to cause you some infertility, right?
yeah.
So, what do you want to do for her?
B,
Say it again. Sorry, I couldn't hear you.
uh, B, the
Okay.
second.
Final answer.
Yeah.
Yeah, right. That's how I would think through this question, right? So, she had a dilation and curettage, right, of a miscarriage, right? That probably caused scar tissue inside the uterine cavity, right? So, what is that going to cause, right? If your endometrial layer inside your uterus is covered with scar tissue, then you're not going to have regular periods. If you're not going to have regular periods, if someone had a miscarriage, I'm assuming that their mentality is they want to have kids, right? And you have to ask yourself, okay, so if you do in vitro fertilization, is that kid going to survive with adhesions? Probably not, because you can't really grow very well. And then if you add kind of, gonadotropin releasing hormone agonist therapy, this is not a per se hormonal issue. This is a structural issue, right? So you got to be able to kind of open that up, right? Get rid of those adhesions, right? And then hopefully the endometrial layer can heal well, and then you can kind of start being fertile again and have kids.
When
Okay.
it's secondary amenorrhea, kind of what is primary versus secondary? And primary is like a problem with the ovaries itself versus secondary is just everything else, or
Let's see. Okay, let's see. Oh, did timeout? Let me see. Primary amenorrhea occurs the absence of menstruation by age 15 with no secondary characteristics, or by age 13 with secondary characteristics. Secondary amenorrhea is cessation of menstruation for 3 months in women who have previously had regular menstrual cycles. So it has nothing to do with, you're thinking of more of an endocrine standpoint. So I understand where you're coming for here. But I just wanted the exact definition. So primary amenorrhea just means like you never had a period, right? By age 15, which is abnormal, right? You should have hit puberty and had menstruations before that. Secondary amenorrhea, right? Meaning that you used to have cycles, but then you have 3 months without cycles. So that's secondary.
Yeah. Okay.